Why do doctors insist that I ask questions but get annoyed when I finally ask them? Just sounds like a weird and a jerk-ass doctor. One thing I learned by knowing a lot of people that work in healthcare is that they can't wrap their mind around the fact that there are people that don't work in healthcare and that don't know the stuff they studied. He probably instinctively thought it's a stupid question. Everyone knows how you close an incision. This is so true. I ask a question and they act like I am crossing some kind of invisible line. I mean, that particular situation sounds like he was asking if you had questions about your recovery going forward. The question you asked was just about the process itself. It's weird that he was so insistent on you asking a question if you expressed you were confident you could manage your care. Honestly, I hate to say it, but the surgeon you met with probably either forgot what their own personal mission was by going into medicine, and or their clinic, hospital was bought out by a healthcare PE firm that cultivates an environment where doctors end up seeing their patients as a checklist to run through to hit internal KPIs instituted by the org they work for. Both lead to poor patient education outcomes on being aware of what is actually going on with your health, which is super unfair to you. I usually say, shop around for a better doctor, but our healthcare system makes that nearly impossible to actually do. I hope you're okay. I'm glad you were able to get the surgery done. Please lean into the healthcare subs on this site for advice. It's not perfect, but they are filled with physicians who genuinely care and are frustrated by their peers dismissing patient concerns. Yee. I've had the same. They were always asking whether I had any questions while visibly impatient and wanting to leave. But I do think a lot of it is that they're always overworked and understaffed. So there's a conflict. They know they have to ask if the patients have any questions, while at the same time they don't have time to do their job properly. I know it's unacceptable that the patient should suffer because of it. But we should also remind ourselves that there's a system behind that seems intent on making life more difficult for all parties involved. Patients but also medical personnel. Sometimes we insist to make you feel comfortable because I know some people are polite and don't want to be a bother. The only time I get annoyed with patients is when they come up with questions just to ask questions, like a form of small talk. And it's always when you're busy as hell. My favorite one is when they ask, "Why did you choose this specialty?" The other is when they ask about other medical issues completely unrelated to what surgery they're having or what I'm treating currently, like getting a second opinion. Then I'm like, UGHH. But it sounds like your doctor was kind of being a dick. No, you're not missing anything. I dislike doctors because not only have I worked with them, but I have been a patient often. A common nickname for doctors is Dr. God because they think they are. Because you wasted his time by stalling and then asked something he regarded as a tourist question, rather than something germane to your recovery like, "What should I do?" Not a good bedside manner, but that's my attempt at telepathic reconstruction. Edit. The standards of care he is subject to may require him to answer patient questions, so his annoyance might be directed 100% at the environment he is in, which force him to induce you to ask a question, even when you're already good, so he can check that box. I think it's a CYA move. So if you later have an issue or complaint, they can say, "Well, the patient didn't have any questions or concerns at the time." It's a bad doctor. You should ask questions even if they seem irritated. I think for some doctors, saying, "Any questions?" is just kind of instinctual. And they don't expect any. And if they get any, they expect it to be super quick and easy. So when someone actually asks something, it throws them off. Kind of like at a store. When they say, "Did you find everything okay?" I always wonder if that cashier really wants you to tell them. Do they really want you to say, "Actually, no, there's this specific spice for an Indian dish I couldn't find. Any advice?" I feel like even though they asked, they don't really want you to jump to detailed questions at the moment. Or for more common, it's like when someone casually says, "Hey, how are you doing?" You are supposed to just say, "Good," or "Okay," or whatever. You aren't actually supposed to really tell them how you are doing. Edit. To be clear, I'm not justifying this behavior in any way at all. Surgeries and medical things are a big issue, and we should all be able to ask as many questions as we want. I'm just pointing out the human, selfish justification for the reaction. Tell them why you don't have questions if you did research or thoroughly read all the information you were given. It lets them know you aren't a moron. I've met a few doctors who are really used to having patients who do zero investigation into any diagnosis or treatment and expect the doctor to tell them everything in the appointment. Hell, I've seen it in person in the lobby. Asking the receptionist, she said, "Last time I have diabetes. Am I going to die? What do I do? Did you read the papers we gave you?" I'm not the doctor. You need to wait and ask her. When I met with her myself, I saw her sigh with relief when I gave her my thorough history on my chronic thyroid issues that have been stable with meds for a decade. I've had doctors get upset with me when I tell them a certain medication doesn't work on me. Obviously, I must be a drug addict if I know what I can and cannot take. This was at an urgent care U.S. when I couldn't stop vomiting. They wanted to give me X. I said X doesn't work. So they gave me X. After 3 more hours, I said, "Obviously X doesn't work, can you give me something else?" Within 15 minutes I was better and could go home. Doctors are not my favorite people. Sorry, nice doctors. Maybe your doctor just followed the hospital protocol of telling patients they can ask away. But deep inside, he don't really mean what he's saying. Lol. Endometriosis is when tissue that is supposed to grow in your uterus randomly grows elsewhere. Way more common and less scary than that makes it sound. And he prob saw some. Might explain if you have bad pain ever. They were asking, "Do you have any questions about the next steps in your recovery? Things to avoid, timelines, etc. Not mechanically how they performed the surgery." Most people aren't trained to be effective communicators or teachers, in the sense of parsing and relaying information to answer a query. Don't be afraid to ask questions. They're treating you, and you deserve answers. If they get annoyed, that's on them. You don't go to doctors for social acceptance or approval. You go to doctors for treatment. Part of their job is to answer questions. I know sometimes it's a lack of options. But if you can, ditch the meanies and get a doc with better bedside manner. Medical staff always insist that I ask questions. I noticed that you use the general term, medical staff, versus surgeon. Surgeons are generally not known for their bedside manner. Maybe this is why other staff are recommending you ask questions. Because they know that surgeons by and large are not good at patient communication.
If you enjoyed this video, please check out our playlists full of similar content. Epic Ericast is like doom scrolling for your ears. Please like, share, and subscribe.